Hello everyone, welcome to RCD ShareNet. I'm Ella Huang. Today I'm going to talk about services for people with disabilities in Canada. Many people realize that in Canada there are lots of services and benefits we can access. However, many people also find that it's difficult to find them or to understand the eligibility criteria or the application process. So I'm going to tell you a little bit of the benefits that people with disabilities, including children, can apply. Mind you, today we're only going to talk about an overview of all these benefits and services. I'm not going to tell you very in-depth about the application process, the eligibility criteria, because everyone's story is different. And because of that, some of the benefits, some people may be eligible to apply and others not. So it's very difficult to generalize that. So I'm going to give you about a basic information of the benefits. So just to help you to understand what's going on, with this structure. First of all, people find it difficult to look for benefits because Canada is operating on 3 levels of government. They are all with full autonomy, so they have their own system. Very seldom their benefits would overlap with each other. So if you get one, you probably won't get exactly the same from the other level. So basically the 3 levels of government we're looking at are the federal government, provincial government, and municipal government. With that in mind, so you understand that they may be looking at different areas. Some of them would be applicable to everyone or citizens, and some are not. So let us have a look at that. Before we go into the different benefits and services, I also want to talk a little bit about how the services are offered to citizens in Canada. So obviously those are from the government. Then we have the government ministries, offices, the 3 levels of government. But because of the vast geographic coverage of the country, we don't have sufficient resources from the government to offer all the programs and services and benefits they operate. So they make use of a lot of the non-profit organizations. So a lot of times you see funding coming from the government, and they would go to non-profit organizations and they would deliver the actual programs or the services. So that is good to remember that. And there are also charitable organizations, they may function in the same way. Other than that, in Canada, we have a lot of service clubs, like the Rotary clubs, Lions Club, variety clubs. They also offer different services to people with disabilities. They may or may not overlap with what the government is doing, but because they are at the grassroots level, they more or less would react or respond more in a timely fashion to the needs of the community. So you can see a lot of that. And others are the commercial businesses, so the private sector. A lot of them which are community-minded, they would have, say, scholarships or funding for organizations to deliver some services to the general public, including people with disabilities. Other than that, we also need to understand with the government structure, because again, Canada is a large country. So when they roll out different services, support, benefits, it's difficult to cover everyone. So they would have different target audience. Very general, I just separate them into children is 0 to 19, Again, it may differ in different provinces. In BC, it's mostly 19, but then in some under the jurisdiction of some ministry, the cutoff age might be 18. So it depending on what we are talking about. Youth is from 15 to 30. Adults 19 to 65. And seniors is over 65. So we're not saying seniors are not adult, but then when they get into 65 and over, they may be able to access a different array of services and support. So we want to bear that in mind. Now today, I want to focus on talking about services and support and benefits for children with special needs. In the next part, I will be talking about adults, but in this session, we'll be talking about children only. So we can have a slide on that. You can see that mostly for children with special needs. So they are not generally just for children, it's for children who require some special support. And then mostly, under the three ministries here, under the provincial government. So one is the Ministry of Health, and in Vancouver and Richmond here, we're talking about Vancouver Coastal Health Authority. Of course, there are a number of other health authorities around. So they may or may not be doing exactly the same thing, but more or less similar. The Ministry of Education, we're talking about the school board. So for children, they are going to school mostly. So the school board plays a very important role in providing services for children with special needs. And then it's the Ministry of Children and Family Development. So they're mostly providing support and services to family with children with special needs up to the age of 18. So that is very important, depending on the age group, the condition of the child, your family situation, you may be able to access different support and different assistance. When we talk about children with special needs, though, a lot of times the parents may find something, they will say, they notice something maybe in the developmental progress is not as good, right, with their child as compared with other children. So mostly is the first step they would do is to go through the health system. They would bring the child to a family doctor. So here also the medical system is a little bit not so straightforward. So we always go to the family doctor first. And based on the assessment of the family doctor, they may refer the child to different directions. So if they're not sure what happened, they probably will refer the child to a pediatrician. Or if they notice something with a medical condition that they can identify, they would refer to a specialist. And if they know, kind of maybe some risk of the child having a special condition such as a developmental disability or a disability, they may refer the child to an early intervention program. If autism is suspected, then they probably would refer the child to Children's Hospital because Children's Hospital has a program to do the autism assessment. So really depending on, the resources the family doctor has. So when you bring the child to the family doctor, it's better to provide as much information as possible. Because for a child, what kind of things that you have observed that you don't think the development of the child is not, as it should be. So in that case, then provide the family doctor a little bit more information. So after this step, then it is a little bit clearer what the paths may be, whether it is to a specialist, to a program, or to the hospital. So then we want to talk a little bit about the early childhood intervention. So we also have a slide on that one. The early intervention therapy program is actually offered through the child development centers in the community, and they will support families with children or infants who show signs of or at the high risk of having a disability, or mainly developmental delay, or a disability or medical condition. So if the family doctor has resources on them and suspect that, they may refer the family to the early intervention therapy program. And I mentioned earlier, as BC Children's Hospital, they have the autism assessment program. However, if that is a long lineup for that, and if the assessment is not coming in a timely fashion, some families may decide to do it privately, so they can have a psychiatrist or psychologist to do the assessment. The reason of having an early diagnosis is important for children with autism, because there are different support and benefits in place. And as early as possible to access this support and benefits will be more beneficial for the child's development. So then to do that, and with that, if the diagnosis is confirmed that the child is having autism, then the family can apply for autism funding. Autism funding is, I'll talk a little bit more, I think, in the next slide. Then the next one is the Infant Development Program. The Infant Development Program is mainly a home-based prevention and early intervention program. So the child and the family is supporting the child at home. So there are other resources available and assistance available to do that. And this is mainly for infants up to young children up to 3 years old. So the time frame we're talking about is very short. If the parents are in denial or not knowing what to do and wait for a few years, and then this kind of support will not be in place. So once you, that is a sign of, maybe a developmental delay or maybe some issue that you're concerned about, go and consult with the family doctor and get all the pieces of information in place, and then you can make the decision what to do and what to access. So to access the infant development program as in your area, you can ask the public health nurse or the family doctor about it. Then the next one is the Supported Child Development Program. So this one is a community-based program offered through, I mentioned earlier, like nonprofit organizations or charitable organizations. So, or some organizations contracted by the government to deliver the program. They offer a range of consulting and support services to children, the family, and child care centers, so that the child who require extra support will be able to get it. And then that is also done in a way that it is more community engagement. So it is not kind of a standalone program. You will meet with other families in the community, also have the facing the similar situation. And then the peer support piece is very important here. Then after all the diagnosis done, the child is ready to go into school. So we have a slide about the education assistance for children. So when the child with a positive diagnosis going into the school board would start looking at the needed services to support this child to go through education. So again, I want to emphasize is if the diagnosis is not in place or the family has no clue what's happening, then the support may not be arranged. And then that will be quite a struggle for the child to go through the school system. So if that is any doubt, just try to find out exactly what's happening. So with a positive diagnosis going into the school, then you communicate with the school board and then also the staff at the school that your child is attending. Then most likely they will provide different services and support, such as the learning assistance services. Then they will do psychoeducational assessment and counseling for the student as well as the family. They will have a modified curriculum because, like here in most school boards, they support inclusive education. That means all the children in the class would study together, but for a child with special needs, they may need some special accommodation in order for them to learn effectively. In that case, a modified curriculum would help. And all the students, including a child student with special needs, will have individual education plan. We cannot undermine the importance of individual education plan, IEP. A lot of times the parents may not want to discuss too much and just want the child to go to school. In fact, the school is an environment the child can learn and develop. And if we have the right support there, they will do this faster and in a more effective way. And this is the IEP. The IEP will outline what is the special needs of the child, and then they can provide the special accommodation and support for the student. So that is important to attend IEP meeting and then let the school and the teachers and the educational assistants to know what is the parents' expectation of the child. So in a way, they're all on the same page, and it is a better service for the child. Then it's the learning assistant and resource teacher. So learning assistant is to support one-on-one on the child, maybe one to a few number. So we also know that in the primary setting, these services are very good. They're adequate because, you know, the number of the level of support is higher. However, when it gets to the high school, and we know that the number of primary schools and high school, the numbers are totally different. Because the high school, they're more concentrated, you know, like in one location, and then they have more children going to the high school. So the care at the high school, you know, sometimes it may be less. So the transition is important for the child going from the primary to high school. And we would always say that ask the parent to pay more attention to that, and then to make the transition as smooth as possible. And also important is to get the psychoeducational assessment done before going to high school. That would help the development of the child at the high school. Okay, so then other than that, then we're also looking at what other services available for the child. So we are talking about social services for children. So it is important to affiliate with some government department, such as the MCFD, Ministry of Children and Family Development. The reason is they will have social worker to support the development of the child as well as the family. Because having a child with special needs might be taking a toll on the family and the parents, and we don't know what to expect. So it is good to have some support. So here is with that is the number one is from the MCFD is at-home program. At-home program, it provides a respite service for the parents and also some medical needs for the child, such as medical items, equipment, and this is for children and teens with a severe disability or complex health issues, such as, you know, wheelchairs or some special machines that would require to support the learning and the living activities of the child. So that is important to communicate with the social worker of your needs. If you notice anything, if the child is not, you know, like sleeping well at night because of sometimes some children may have sleep apnea, so they don't breathe very well during the sleep. In that case, they can have this special machine through the MCFD to help the breathing while the child is sleeping. So this is something that might be a financial burden on the family, and that can be supported by the government to do that. And the next one is autism funding. So after the positive diagnosis of autism, then the child who's diagnosed under 6 can have up to $22,000 per year. And the child aged 6 to 18 can up to $6,000 per year. So this funding, the autism funding, has very strict usage, how you can use the fund. The funding is mainly to help the family to pay for some professional consultation and services, such as and in order to promote the development of the child, such in the skills, academic, life skills, and things like that. So they're mainly for therapies, consultants, and some example of that is behavior consultants, life skills and social skills programs, family counseling, and more. So if the child is eligible to receiving autism funding, then more information can be obtained from the government how to use the fund. And there are family support services. There are child and youth care workers, social workers that I talk about, because sometimes to access the service of a social worker is not as simple as it looks like, especially when there a social worker that affiliates with the government will be able to provide with more resources, about government benefits, support, community services, and so on, professional support and respite. And other service for children is out of home living. So if the child cannot, for some reason, cannot live at home, then that will be supported to live out of home. And the other MCFD services, the Ministry of Children and Family Development, the services include child protection, brain injury program, fetal alcohol spectrum disorders, mental health services, nursing support services, deaf and hard of hearing services, etc. So that you see, there are a lot of support and services in place, but to realize which one to look for, or because everyone, they more or less have their own application process. So sometimes it is a bit too overwhelming for parents. So I would always suggest is when you're facing that, of course, we want to act in a timely fashion, but it is also important just to step back a little bit, relax, and then do things one at a time and don't give up. That is very important, because there are services available out there, but just sometimes it is very difficult to find the right one. Connect with an organization, a nonprofit organization, a community organization to learn more, such as the Richmond Center for Disability. Welcome to give us a call if you have any question. We can always guide you in the direction and support you through the process if needed. So that's all for today. Thank you for watching. And the next part, I will be talking about the benefits, supports, and assistance for adults with disabilities. Thank you.